Hello. Thank you for participating in this RBT training. This training program is based on a registered behavior technician task list and is designed to meet the 40-hour training component for the RBT credential. The program is offered independent of the BACB. So, first we gotta discuss what a stimulus is. A stimulus is anything that a person can react to based on their senses. A stimulus can basically be anything. It's basically anything a person that can react to based on their senses. Sight, smell, touch, hearing, feeling. So again, a stimulus can basically be anything. Basically anything a person can react to based on their senses. Sight, smell, touch, hearing, feeling. So for example, if your nose is really plugged up and you couldn't smell anything, a foul odor would not be a stimulus for you at that point. Whereas if you could smell perfectly fine, a foul odor would cause you to react. Or, if I covered up your eyes and you couldn't see, a visual stimulus wouldn't do anything. But if you could see, it would. So again, a stimulus can basically be anything. It's basically anything a person can react to based on their senses, their sight, smell, touch, hearing, feeling. So, what is an SD? You'll hear that term a lot in ABA. SD broadly stands for discriminative stimulus. Technically, if it is an SD, then it signals that reinforcement is available if the correct response is given when that SD is available or when that SD is present. So let me read that again. If it is an SD, then it is a signal that reinforcement is available if the correct response is given. Basically, it's basically like this. It's like pretend like the stimulus was saying this. The stimulus would say, "Hey, if you respond this way when I am present, you get what you want." So, just pretend that the stimulus is saying, "Hey, if you respond this way when I am present, you get what you want." And SD signals that reinforcement is available. So it is a stimulus, but when we say SD, a discriminative stimulus, it signals that reinforcement is available. The SD and the RBT. In programs, you will be giving SDs. These SDs are the instructions that you'll be giving to the patient. By using reinforcement contingencies and providing reinforcement, you are saying that if you follow this instruction, you gain access to a reinforcer. When you do that, you are making your instruction an SD, that if the person follows the instructions, they will get a positive consequence. So, let's say you give the instruction, touch nose. That's the SD. So, if the person touches their nose, they will get reinforcement. The stimulus, touch nose, when asked by the RBT, is a discriminative stimulus because you will provide reinforcement when they touch their nose after you present that instruction. However, when you say touch ear and they touch their nose, you would not provide reinforcement. Therefore, touch ear is not an SD for them touching their nose because they will not get reinforcement for touching their nose when presented with the stimulus, touch ear. Again, the SD is a stimulus that signals that reinforcement is available if they engage in their behavior that the stimulus is promoting. So when you say touch nose, and they touch their nose and they get reinforcement, they are learning that when the RBT or when someone says to touch their nose, that they touch their nose because of what it gets them. And this is why we will teach multiple body parts or multiple exemplars of anything, because we want them to learn to discriminate. Because we don't want to do that thing where we say touch ear and they immediately touch their nose. We want them to pick up on the fact that we are saying ear. So we would only reinforce touching the nose if we asked touch nose. And we would only reinforce them touching the ear if we said touch ear. But we would not reinforce them touching their ear if we said touch nose. SDs should be considered one of the most important things that you're going to be doing as an RBT. Knowing what an SD is, an instruction that signals that reinforcement is available, is highly important in working with your patient. You should understand that SDs are basically the instruction that says, hey, if you do this, you're going to get this. If we can develop this, we're going to be able to teach that patient the goals that they need to address the deficits and excesses in their life. So SDs should be consistent at first. Remember, we are trying to teach the discrimination part, where that if you do this during this time, you will get rewarded or reinforced. And if you answer or don't respond correctly when I give that instruction, you will not be. Remember, we are trying to teach the person to respond to the instruction appropriately. Now, as the learner gets more skilled, we can start to vary that SD. We don't want to start sounding too robotic. But at first, we should strive to be consistent when using the SD across what we're doing with the patient. Likewise, the SD, the instruction, will be outlined in the skill acquisition plan. It is important to communicate with other team members what kind of SD you're using. Because touch nose and where's your nose are two different instructions. To a patient who's just learning how to discriminate, it may be too confusing to use different SDs. So you want to be consistent at first. Again, that's going to be different for different patients. But as a general rule, at first, when we're first learning, or when we're first having this person do this, we want to be consistent with our SDs. The SDs should be clear and distinct. Practice using that command voice. This will get the attention of the learner. It should also be done as a command, not a question. We would say touch nose. We would not say, hey, can you touch your nose? They could say no. They could choose not to do it. The point is that the SD is a very important component of what you're working with. Remember, the SD is an antecedent. It occurs before the behavior. So let's see if we can identify the SDs in these examples. Let's start with the top one. Your phone rings. You see that it is your good friend. You pick it up to talk. So what was the SD in that example? The SD was your phone ringing. That was the stimulus, the discriminative stimulus. It was the SD for you to look at the phone. The second example. You see the open sign. You open the door to go into the restaurant and you get your favorite food. The SD is the open sign. Because in the past, the open sign is associated with you being able to open the door, go to the restaurant, and get your favorite food. You see the brake lights on the car in front of you. you touch your brakes to avoid rear-ending them. The SD for your behavior of touching the brakes was to see the brake lights or the brake lights in the car in front of you. And finally, you ask a patient to touch their ear, they touch your ear, and you give them a high five. The SD there was you saying, touch ear. So remember, the SD is basically the signal that tells the person that reinforcement is available if they engage in a behavior.